Hello friends, this is Dr. Raju, pediatrician from Borivali West, Mumbai. And today's topic is a very hot topic: how to prevent kids from getting COVID infection. Number one. Number two, how, what and what not to do when your child has COVID, right? So let's start the session. I've divided into two sessions, as I said. First point, how to prevent COVID in the first place, which is but obvious. And second point, once by God forbid they get COVID infection, how do we prevent and how do we tell the child about do's and don'ts, right? The first session is tips to prevent child from getting COVID. First point, avoid repeated touching to eyes, nose, ears, and of course the mask. Encourage use of tissues when the child is told cough or sneeze, and always encourage the 20-40 formula. Now, I hope you know what is the 20-40 formula. 20-40 formula is very simple. Washing about the hands. If there is a sanitizer with alcohol base, then 20 seconds the child should wash the hands. If it is a non-alcoholic sanitizer, then obviously it is soap and water. So when the child is washing hands with soap and water, it should be for 40 seconds. That is called 20-40 formula. I repeat, 20 seconds for sterilium or sanitizer, 40 seconds for soap and water. When a child is doing this, generally he or she should sing the poem or a poetry, so that by the time the poetry ends, their 20 seconds are over. Right? Second point, they should, whenever they touch the door handles, window frame, the door knobs, they should clean their hands with sanitizer. Keep them busy in activities. Let them pursue their hobbies when they are indoors, like drawing, painting, singing, poetry, etc. Talk to them. Always elders should talk to the kids because they understand everything. You should not underestimate your child that he or she is only 3 years or 2 years. They don't know anything. No, they are very street smart. They are already 20 years ahead of you. So they understand everything. Right? Now, how do we know whether the child has symptoms and signs of COVID? Yes or no? Yes. So very simple. The first and foremost, the child will have symptoms of fever, dry cough, cold, fatigue. These are hot symptoms. That means the child has symptoms of COVID. If the child has fever, cold, dry cough, be alert. It could be COVID, yes. And more perpetual symptoms are loss of taste, loss of smell, nasal stuffiness, stuffy nose, red eyes, sore throat, headache, nausea, vomiting, diarrhea. Remember, diarrhea is a very typical pediatric symptom of COVID. So don't underestimate diarrhea. Everybody thinks COVID means sardi, khasi, and nose based. No, it can be from bottom as well. Remember, in elder child more than 10 years, the symptoms are breathlessness, chest pain, etc. etc. Now, what are the danger signs of COVID? The danger signs of COVID, 5 points. Remember, number one, very high fever persistently for more than 3 days. You must think of COVID. Severe stomach pain with diarrhea. Rash, any red color rash on the body or skin, always and always think of severe COVID, because COVID may not be visible from outside, but inside the bacteria, the virus is multiplying. So be careful. It will be severe form of COVID. Any rash in your child with fever, always think of COVID in this scenario. Number four, extreme tiredness and weakness. Last but not the least, the child has stopped eating. These are 5 danger symptoms of COVID. That means immediately rush to the hospital. Right? Now, what are the other parameters which you will keep in mind? Anybody? Yes, very simple. If the child, God forbid, child has got COVID, now what to do? What next? First step is anxiety. The parents should not be very anxious. They should relieve their anxiety. They should behave in a very distressed manner. They should not take stress, because your behavior will reflect in the child. The child is very sharp and observant. He observes every movement of the parents, especially the ones, the mother and the father or the mother, whoever is with the child. So your behavior should be very ready, should not be radical. It should be justified, right? Now, what are the steps? What you will do if the child has COVID? First and foremost, remember that by default, If the child has COVID, then either of the parent must be positive or both parents. The child may not get an outright infection where parents are negative. That is generally very, very rare. So, what are the points to do when the child has COVID? First and foremost, isolate. Isolation is the first step. Quarantine the child in the same room where there are parents, because the child is a small person. He may not be able to live independently in a separate room. He will be more stressed out. So instead of relieving the anxiety, you may give him more stress. Keep him in the same room where there are parents. Point number two, the parents and the child both should wear the mask. Now, here, remember one formula. If the child is less than 2 years, the child should not wear a mask. And at the same time, parents should also encourage child not to wear a mask if the child is below 2 years. If the child is about 2 years, yes, the child must wear a mask, preferably N95 mask. And parents should also wear a mask, whoever is in the room isolated with the child. Now, the next point, as I told you, 2040 formula, hand washing. Hand washing with sanitizer and hand washing with soap and water. 20 seconds for sanitizer and 40 seconds for soap and water. Point number 4, maintain 6 feet distance in the room. That means if parents are with the child in the same room, they are sharing the same room, there should be a 6 feet distance preferably. And if the child is below 1 year, then 3 feet distance is enough. Now, some parents ask me that the child is only 1 year old, the mother is breastfeeding the child, how to maintain isolation, how to maintain the so-called social distance of 6 feet. Very simple. In that scenario, mother has and she has to breastfeed the child, number one. Number two, breastfeeding is not a contraindication in COVID. Number three, whenever mother is breastfeeding the child, the mother should wear a mask, child should not wear a mask. Point number one. Point number two, the baby after feeding, baby should be kept separately at a distance of 3 to 4 feet away from the baby, the mother. That's all, right? But you must encourage breastfeeding in a COVID positive mother and the child. Next point, increase the ventilation in the room. Keep all the windows open. Next point, when the child has a sneezing, encourage the child to use tissue paper. The child should not swipe the nose with hand, right? Next point, the child should receive food free of infection. That means when the mother and the child are isolated in a room, there the food provider, whoever is providing the food, they should disinfect the food, and the person sending the food should be COVID free. Every 4 hours, encourage the child to measure thermometer temperature and monitoring the saturation. Plenty of rest. The child should take plenty of rest. Encourage decent water intake. The child should drink plenty of oral fluids and juices, because fever and dehydration can lead to severity of infection. Generally, 7 days is a cutoff. What do I mean by this? Generally, after 7 days, the child is free of infection. He or she may not transmit infection to others. However, by default, 14 days of isolation or quarantine is mandatory. So, next point, encourage the child to ask all the doubts about COVID. Encourage the child to ask any silly doubts. Teach him or her everything about COVID. Don't underestimate them. Don't underestimate their intelligence. Encourage them to do all the so-called extracurricular activities like drawing, painting, singing, poetry, etc., etc. Because if they are busy in activities, they will be free of stress. Don't silence their voice. Remember, you create the atmosphere. Your behavior will reflect in the child. If you that panic, you that stressed out, child will be more stressed out. And remember, any child who is stressed, he will be more sick. If he's not going to the hospital, he will fall sick. That's all. Now, last but not the least, remember, you create the atmosphere in your home. Your emotions should not be negative, should not be stressful, and your emotions reflect in the child. So you should have a positive atmosphere. You should encourage positive vibrations in the house. Your behavior should be monitored first. Last but not the least, remember, these 7 days of isolation, your behavior will impact the child's brain forever in his or her own life. So it will permanently leave an impact on the child's brain. So encourage positive behavior. as a parent. So in the end, last but not the least, what I will say, few words: be careful, be positive, be happy, and all the best. This is your family pediatrician, your friendly doctor, Dr. Raju Gujarati from Borivali West, Mumbai.